know from my own experience, after I was diagnosed, there was this moment of, yes, I have answers. And it was short-lived because then I went, okay, now what? And what I think is so great about ADHD Online is that the team there is so well-versed in so many different treatment plans because there are a ton of different options and things are gonna work differently for everyone.
Absolutely. I think most people, when they look at ADHD, they think, oh, stimulant medication. That's the answer. Well, there's also non-stimulant medication. That's why a professional, a physician, nurse practitioner, they determine really what works best for someone. And again, about 70% of people with ADHD utilize medication, but that's one part of the treatment plan. There's also therapy, cognitive behavior therapy, which is short term, effective, change the way you think, can change the way you feel. There's parent training, there's social skills training, because there's just so many different treatment modalities that go into helping someone live the very best life they can with ADHD.
And the great thing for anyone who's diagnosed through ADHD Online is that they get to have those conversations. They get to kind of put together a customized plan and test it out and see what works. I think for me, I started right off with medication and it did help, but it didn't change my behaviors. And so that's when I added in the therapy, which was working to kind of cut out some of the, I'll just say, the bad habits I had developed prior to getting my diagnosis.
Oh, and I think that is a big advantage. Not only can they take their assessment and diagnosis, obviously, to the treatment at ADHD Online, but someone could take it to a different provider. But at ADHD Online, we now also have teletherapy. It's not just about diagnosis, not just about medication, but in many states, we also have the teletherapy that can help somebody change those behaviors.
And we've seen so many advancements in telemedicine because of the pandemic. But what I have seen from so many of my friends who were hesitant about jumping into therapy, teletherapy is such a great option because it allows you to do it from a place you're comfortable.
It does, and the research really shows that it is as effective as in-person therapy. So I think it has been a huge advantage. Or for someone like me who's in Texas, there can be 800 miles between providers. So for somebody that lives in a rural area, this is totally a savior for them.